Now, the funeral industry in South Africa is already starting to feel the brunt of South Africa's third wave of infections. This as the country continues to register an increase in COVID-19 related deaths. Yesterday, 265 people succumbed to the virus, taking the death toll to 64,138. To discuss this, we are now joined via Zoom by National Funeral Practitioners Association of South Africa President Muzi Hlengwa. Mr. Hlengwa, thank you so much for your time. Now, we know that the third wave has probably seen the numbers as it relates to daily deaths rise more than we saw in the previous waves, the second and the first. Talk to me about just how bad the situation is for your members currently.
Good afternoon to you, Nati, and good afternoon to the viewers at home. We are currently under pressure. We're taking a strain and we are not really doing as well as much as we would like to. But this time around, we were better prepared than we were during the second wave. And I'm told that in Gauteng, in some areas, they've already ran out of coffins, but we are working hand in hand with the coffin suppliers to ensure that they assist those areas where they have or are experiencing shortages. This morning I had a chat with some of undertakers who have already ran out of a storage facility, who are now looking into getting some other means of storage facilities. So we are working on it. We are on point. I'm sure that we will cope in due course of time.
I hear you say you are coping, but if you've run out of coffins and you've run out of storage space, how are you handling this in Gauteng, especially because we are at the epicenter of this pandemic?
Yes. Look, there are many other reasons why the industry has run out of coffins other than just the COVID-19 issue. But it is common that when the death toll increases, we will experience these kinds of challenges. What we have done in other areas, we have stored more on coffins so that when this comes and we are not caught with our pens down. But it's clear that we didn't do enough in Gauteng to ensure that we have more coffins as we would like to have. But we are working on this as the industry, and we are sure that we're going to be able to win in the end. But some of the challenges are caused by the shortage of cemeteries. Now we have to keep bodies longer than necessary. As I'm talking to you this morning, I got a call that one cemetery that I'm not going to mention the name in Gauteng was only digging graves at about 10 a.m. in the morning. As you know, in Gauteng, some of the what you call funerals will start as early as 8 o'clock in the morning. So we are appealing to everyone who's in charge of ensuring that cemeteries are available to make sure that we don't have these kind of glitches as we try and face the situation.
One of the other things that we understand your members are struggling with is when it relates to cluster deaths, and that's when you are burying multiple family members. Talk to me about how you are, what the challenge is as it relates to that, because, I mean, we are seeing more and more, especially in Gauteng, where one family member passes 2 days later, the other who had also contracted COVID-19 also then dies. What sort of implications does that mean and the challenges that you are facing?
Yes, it does happen. Look, it's something that an undertaker has got to put himself in the shoes of the bereaved family. You know, we over the past two waves, the first and the second wave, we have noticed that when one member of the family passes on, the likelihood is that in 2 or 3 days, there will be another member in the family that will pass on. I remember at some point in time during the second wave, I had to remove 3 bodies in one day from one family. So these are the things that we anticipated. So I'm urging undertakers to work to hand in hand with the families. I understand that at some point in time, you'll be strained in terms of the storage facilities, and you want to get bodies out as soon as possible. But in some point, you will have to bear with the families and wait if they say they want to wait and see if the one that is hospitalized is able to make it or not.
Mr. Hlengwa, I'm hearing you say that at one point you removed, 3 bodies from a family. A lot of the time we don't ask this question, but how are you doing and your members psychologically? How has this impacted you personally? How has it impacted some of your members?
Look, the thing is with families, you will notice that even during the days of HIV/AIDS, a mother will say, "This is my daughter" or "This is my granddaughter." Then, at the end of the day, they will not be careful enough, and they will not observe the regulations that are there. But we, as I've said, we have a responsibility of ensuring that we give members of the public some form of education, because I think this is what was lacking. We should have, as the country, educated people. What we have done maybe in the past is that fear was installed instead of educating people and to make sure that they are safe from this pandemic.
As a final question to you before I let you go, at the moment you're saying you are coping as well as you can. In the first and the second waves, we saw the beta variant. We now know that the Delta variant is very infectious. How are you handling the bodies at this present time? Or have you adapted to new ways? Or has there been a change in the way that you are burying bodies now?
Look, when it comes to the disease poses not much danger of infecting anyone with COVID. This is something that we had discussed with the Department of Health, and it was cleared by the World Health Organization that dead bodies are not likely to infect anyone unless you come into direct contact with the deceased. So we are saying to undertakers, they must just carry on using the PPEs as it was directed before. Make sure that you still take those extra precautions to make sure that you don't infect yourself or reinfect others in the process, So we are making sure that we are as careful as much as possible. Something that we have realized on this kind of a variant, it doesn't take too long for it to show itself and take a person away. You will have a situation whereby the family says it was just 1 or 2, 3 days, and then the person had died. I'm talking on my personal experience where I lost my father-in-law in 3 weeks' time, who only got sick 2 days and then he was gone. So with this kind of a variant, we are saying to people they must be very, very cautious and make sure that they social distance and they wear a mask and they take all the precautions that are necessary, particular to our undertakers and those who are working at the mortuaries and those who are working at our receptionists and office clerks as well. We must all try and make sure that we take good care of ourselves. But before I leave, I want to pass this message to all undertakers, particularly those who are in KZN. the situation is not the one that we would like to have in the country. A lot of undertakers were complaining that their cars have been destroyed this morning, and it's not easy to move. We are again appealing to the members of the public to bear with us should we are unable to come and remove bodies, particularly during the night, because it's not safe for us to do so. I'm sure everyone is watching what is going on in and around the country, so we must be given an opportunity to make sure that we only send a vehicle when we are confident that it's safe. If it's not safe, unfortunately, we will have to delay maybe and come and remove the body in the morning.
Right, Mr. Hlengwa, thank you so much for your time this afternoon.